Good afternoon, everyone. Thank you for joining me today for our Planning for Retirement webinar. We have a great presentation today to give you guys all a little bit of more insight as to what might occur during the retirement process. You're thinking about coming up to retirement maybe in the next couple of years, and you'd like to know what needs to be done, what needs to be thought of ahead of time to make sure that it's a smooth transition into retirement. So we're going to go through a few key points, and of course, I ask you that if you do have any questions, please email me at the end of the presentation, and I will be happy to get back to you in a timely fashion with all the questions that you may have. And of course, we can set up a time to speak by phone or have a meeting to go over in a little bit more detail your plans for retirement or just any plans in the coming future. This presentation is going to be recorded, so if one of your colleagues or you have to leave early or just someone didn't make it to the presentation, we'd be happy to send out a copy afterwards as well. So let's go ahead and begin. Sorry about that. We're having a little bit of technical difficulties. Sorry about that. Let's go ahead and get started now. So again, sorry about this. This is a slide that's supposed to talk a little bit about Cirrus. We were founded back in 1994, for those who were not aware of that before. We are comprised of two main specialized business units. We do lease negotiations for doctors and dentists, and we do a lot of healthcare consulting as well. That's the main focus of today's presentation. But if you know the leasing part does come into play here with the retirement side of things, so we might get you in touch with one of our leasing consultants to give you a little bit more information about that. So some quick facts about family physicians today. Better compensated in Ontario than anywhere else in Canada. About 75% of all physicians say that their pay does not align with the care they deliver, meaning they're providing complex care, they're seeing their patients, but their pay does not really represent how much they're working. So we want to make sure that that comes into play and make sure that everyone is being compensated for the care they're providing. The majority of the province is in the faux model. It is the most advantageous for family physicians today, giving them that that work-life balance that everyone's looking for, not having to work crazy hours, but still getting paid appropriately for the care you're providing. Generally, they're not strategic about how they're being paid. So the OHIP funding model can be quite complicated, and as you guys know, there's lots of billing codes, in basket, out of basket. Not everybody knows what to do, so we want to make sure that people are aware of that as they prepare for retirement to make sure that they're making as much money as possible and providing that good nest egg for them once they do retire. And physicians are not necessarily aware of what needs to be done when they retire. Now, some people think, oh, I'm just going to retire, close the doors, walk away, and that's it. But as we're going to see today, there are many aspects of retirement that need to be discussed and thought of beforehand. So the purpose of today's program is to think about it. Are you planning to retire within the next 5 years? Maybe 6 years, maybe 7 years, but if it's in that time frame, you really need to start thinking about things right now. And we're going to let you know what you need to know. So retirement and transition planning. So some of the first steps that you want to think of when retiring, are you going to be full-time? Are you going to be part-time? Is it going to be an all-at-once retirement? You know, a lot of people want to know, I'm going to cut back my hours. Some people are working now, let's say 3.5 to 5 days a week. I want to cut it back to 2 days a week, work a little bit less, but still keep my practice going. So I don't want to fully retire. What are my choices? What are my options? At that point, we're going to want to figure out a date. So let's say, again, you want to retire in 3 years from now. let's say we're going to bring in on an associate or a locum to work with my patients ahead of time to make that transition easier. Informing your staff. So do they have an employment contract? Do they not? In either case, it is very important to let your staff know well in advance. I mean, a lot of you have staff that have been working with you for a number of years. You have a good relationship with them. You might even say that you guys are good friends. So you want to give them the opportunity to A, find a new job, B, decide whether or not they want to stick around if there's a new physician coming in. You really need to know what the law says about that. So in some cases, giving them a severance package up to 2 years in pay. But for those little aspects, it really is important to speak to your lawyer about that to make sure that all your rights are being met and all of their rights are being met also. Again, we don't want to have any issues come up afterwards to, with wrongful dismissal or, not giving them enough time or whatever the case may be. So for some aspects of the legal side, it really is important to speak to a lawyer and find out what needs to be done with regards to your staff. Now, if a new physician is taking over, give them the option. Do they want to stay with the new staff if the new physician wants them? And if they're not, then they can find a new job. Maybe they're at the age of retirement as well, and they don't want to stick around either. So all these little aspects really do come into play when starting to think about whether or not you want to retire soon. So whether or not you're in a group practice or solo practice does make a difference as well. So let's speak a little bit about the group practice first. So the governance agreement. Every FO has a governance agreement. Every FO's governance agreement is a little bit different. Some people might have some legal obligations to the group. There might be some cost-sharing responsibilities. If you are in practice for a number of years and let's say there's 10 of you but only 5 of you are let's call it partners in the agreement and the other 5 associates are paying into it, what happens then? If you leave, do you still get pay? Do you have to get bought out? What happens to that? So again, giving the group minimum notice, trying to figure out what's going to happen to your shares of the ownership. Are they going to get transferred out? Are they going to get dispersed evenly among the remaining partners? Are you going to remain a shareholder within the group? Things like that. Now again, as I said earlier, your lease agreement is a huge part of your practice and really does come into play when thinking about retirement. Is your name on the agreement? In what capacity is it? Is there any personal commitment to the landlord on your behalf? Is it your MPC that's on the lease, or is it your name? All these little aspects that many people don't think about really do come into big play here, and we really need to start thinking about it. Are you going to sell your patient's roster to your group members? Now, do your group members want to take on your roster? Are they going to look for an associate to come in? Is it your responsibility to look for an associate to come in? Again, bringing on somebody to take care of your patients with you for, I would say, the last 6 months to a year before retirement really gives your patients a good opportunity to get comfortable with the new physician, giving your group the opportunity to not have a huge disruption as to what's going to happen to these patients. Maybe they don't have the time or availability to see extra patients, and they don't want the responsibility of it. So bringing on a new associate, like I said earlier, coming on as a locum 6 months to a year in advance, allowing the patients to get comfortable with the locum or the new physician and vice versa, and then the new physician wouldn't have as hard of a time to keep those patients as they move forward. So in a solo practice, things are a little bit different. You don't necessarily have all those other responsibilities. However, if you're still part of a FO and you're working on your own, you still again have to make sure that your governance agreement is met accordingly, with proper notice given to the group. If anything needs to be settled with regards to cost sharing or anything like that, that really does come into play. But let's talk about selling your practice. I know a lot of people are going to think, how much is it worth? How much can I sell it for? Back in the day, people used to buy and sell practices. It was a big part of the industry, but lately it hasn't been that way. But that's not to say it isn't coming around again. We have seen in the recent history, a few practices being bought and sold. Now, in the foam model, there is actual value in the roster. I mean, there's hard money that is there for you right on day one. I mean, you take over a roster of patients, you're getting paid for those patients as of day one. So there is value there. Now, coming up with a proper value of what your practice is worth to somebody else, that gets a little bit trickier. Again, there obviously is a dollar value. We can say it's about $200 a patient per year that a roster is worth. Again, how much is somebody willing to pay for it is the big question. So we'd be happy to sit down with you and go through your roster, go through your practice, see what type of bonuses you're getting based on your patient population, how much you're earning in capitation exactly, and then try and put a dollar value on it. Now, that's not to say you're 100% going to get that value by selling your practice, but we'd like to think that there will be some value there in order to sell your practice, because you guys have worked hard to build up the practice over a number of years and get established, and patients are loyal to you. But like I said, if you bring in somebody ahead of time to work with you to get to know the patients so the patients can get to know them, there will be an easier transition on both parts. So that's really what we need to look at. But again, lease agreement. Are you solely on the lease? Is it your personal name? Is it your MPC? What requirements do you have with your landlord? Anything like that. We will get into a little bit more detail further on in the presentation. But again, something to really think about is your lease. Now, I know a lot of people are thinking more of the medical side, but the lease does really come into play here. So again, if you have a medical professional corporation, what steps need to be taken in order to close it down? So you're going to convert it to an ordinary corporation potentially, close it completely. Again, a lawyer is the best person to speak to figure out what needs to be done in this situation. If your payments are coming to your medical corporation, but you don't want to keep it open and you want to transfer it out to a personal or an ordinary corporation and have any residual payments that are outstanding come to you, that's something that needs to be done obviously with the bank and consultation of a lawyer. As well, you might want to keep it open for a couple months after, just for those lag payments to come through or whatever the case may be, in order to make that transition a little bit more smooth. So some of the financial implications of this. Who do you need to let know? Financial institutions are a big one. Informing your bank of account closures. Again, if you have a separate business account versus a personal account, the ministry has been paying your business account, but that no longer is going to be in use maybe. You want to transfer funds to a different account and close that one. Stop any payments that you have, pre-authorized payments for insurance that you want to close out, or your EMR, or any other business expenses that you have, supplies maybe on a regular basis, and you want to close those out. Letting your financial institutions know is very important. Now, from an insurance standpoint, if you're no longer going to be practicing, obviously you need to re-examine what policies you need. You probably don't need the same amount of insurance that you've had before. So letting your insurance broker know what you're going to be doing or what you're not going to be doing to ensure that you don't overbuy and don't underbuy. We never want to see anyone come into the situation where they don't have enough insurance, and we also don't want to see you overpay and have too much insurance for what you're actually doing. So speaking to your insurance advisors is really important from that aspect to make sure that you have adequate coverage. Some patient notification. Now, patients are your practice. I mean, without your patients, you wouldn't have a practice. So letting them know is extremely important in this situation. Having phone calls and letters and posters, all these different aspects are extremely important to the patients and to your practice as a whole. So we want to make sure that you're giving them adequate notice. We say roughly 6 months. If you want to give them more notice, that's great. If you know that far in advance that you're going to be retiring on X date, then letting them know that you're going to be retiring, giving them the opportunity, A, to find a new physician if that's what they want to do, B, maybe, again, switch to one of the other physicians in the office if they're accepting new patients. Maybe C, as I said, bring on a new physician. You're coming off, you're leaving your practice, you're bringing on a new physician to take care of them. Give them the opportunity to decide yes or no to that new physician. So again, have your staff call them, leave messages, put letters in the mail potentially to say, we're going to be leaving as of this date. Your patient records are going to be available. If you need them, please let me know. I can transfer them elsewhere, or I can give you a copy. Putting posters up in the office as well, just to let people know. Maybe you weren't able to get in touch with them by phone or email or mail, and they come into the office. So letting them know what's going on is very valuable to them. And again, even keeping a phone line open. You probably have your phone line in the office. Keep that open for an extra couple months afterwards, and leave a message on there saying that, I have retired, but, Dr. Smith is taking over my practice, or, so-and-so can help find you a new physician if need be. And that goes a long way with your patients, and letting them know what's going on. And I'm sure you've built that rapport with them, that, the loyalty stands there. So we want to make sure that the patients are taken care of to the best of your ability. Patient records in EMR. So as I said, the patients are obviously entitled to view their records and have a copy of them. From a legal standpoint, the doctor owns the actual physical file, so you don't have to give them originals. If you still have papers or even online through your EMR. The college does recommend keeping them for a minimum of 10 years. So there are many storage facilities, if you have paper files that you wanted to keep. If you have electronic copies, then obviously it's an electronic copy. You don't necessarily have to have storage for that. You can keep that with you. But giving the patients the opportunity to request the records is important. But again, give them a reasonable amount of time. Don't say that I'm keeping it for 10 years. You have 10 years to come and claim it. Give them a year or two to say, if you really need a copy of your records, you can come have them transferred, or you can get a copy of them by me, coming to the office or whatever the case may be. With regards to your EMR, cancel any contracts if necessary, or if you can time it appropriately to finish off your practice at the time of contract ends. Obviously, that doesn't always happen so easily, but again, cancel any contracts. Speak to them, find out if there's any early cancellation fees that might be associated with that. And then again, everything that's electronic has to be disposed of appropriately. So there are companies that come in to wipe your computers professionally, make sure that nothing is available, by searching through the hard drive, because just by throwing it into your recycle bin and clearing it doesn't actually delete the files. There are still hard files left on your computer that we need to get rid of. So letting them know what needs to be discarded and what needs to be kept is extremely important. So winding down your practice. Now, let's look at it from two perspectives. Once you decide to retire, you're either going to bring in a new physician or you're going to walk away. So let's talk about walking away first, as it's a little bit of a shorter pathway. So you're going to find a new physician potentially to come in. They're going to come in. They're going to decide whether or not they want to take over the roster. The patients are going to have their decision whether or not to stay with them. So a roster transfer is necessary. For the first 6 months after the roster transfer has been completed, that new physician will have the opportunity to re-roster or technically officially roster all those patients, those that are willing and want to stay. Otherwise, everyone else after that 6 months will fall off the roster. And then they can, again, start building up their practice from scratch or not from scratch, but from whatever is left over, and to see those other patients either fee-for-service if they're not comfortable, or whatever the case may be. Again, lease agreement, making sure that the lease is transferred over to the new physician, making sure that there are no penalties by transferring it, making sure that the lease is incentivized to the new physician coming in. Now, again, as I said earlier, we do lease negotiations for doctors and dentists across North America on a yearly basis. We do hundreds, and we want to make sure that that lease agreement between you and the landlord is in your benefit to sell your practice or to transfer your practice over to somebody else. So having one of our leasing consultants work with you to renegotiate a lease or just look it over to see what maybe there are some pitfalls in there that we want to get rid of ahead of time before somebody else takes over is really important as well. And the staff transition. Again, if the staff are staying, give them the opportunity to have a little bit of a transition period, a little bit of an overlap where both of you are there working together to make sure that everyone is comfortable and that there aren't any hidden surprises with a new physician coming in, making sure that your staff that have been loyal to you and that have been working with you for so many years are going to be treated the same way that you've been treating them in a fair and decent manner. Now, if you're going to start walking away from the practice, then again, giving notice. Now, when I say giving notice, that means to the landlord, that means to the staff, that means to the patients, as I said earlier. And one of the most important is probably the landlord because, again, you've probably given them a security deposit. There might be some rent reconciliation. There might be some returning of property in X form. Some leases will say that you have to have it in a broom swept manner, just clean enough that somebody else can come in and do whatever needs to be done. Other landlords may say you have to remove everything that you brought in, you have to rip it down to the walls. If you've done any construction to the place, you may have to take that all out. So it really is important to review your lease with us again or your lawyer to make sure that everything is in proper form. And liability. Who's liable for certain things? Again, with the lease agreement, is it you personally? Is it your MPC? Is it a larger corporation that you're part of, a larger group of people? If you're part of a group, how many names are on there? What happens if one person leaves? Who does the responsibility shift to? So all these little aspects really do make a big picture that needs to be addressed. And financial obligations too. Are you cutting your lease early? What is the penalty for that? Do you have to pay out your colleagues? Do they have to pay you? All these aspects need to be determined ahead of time to make sure that there's a pleasant process of winding down your practice. Now, who requires notification from a ministry standpoint? From medical associations and organizations. So we have the Ministry of Health and Long-Term Care. Of course, you're going to have to let them know that you're quitting your practice or leaving your practice, and that either somebody else taking over or you're just walking away. The Ontario Medical Association, the Canadian Medical Association, the College of Physicians and Surgeons of Ontario, the Royal College, the College of Family Physicians, the Ontario College of Family Physicians, and the Canadian Medical Protective Association as well. So all these people need to know. Maybe you came into this presentation thinking, oh, there's not much to do when I retire, but as you can see, there are quite a few here that 8 different organizations or associations that need to be made aware of that you are retiring. So it really is important to know who needs to know and let them know in a timely fashion. So some of the Cirrus services that we will be able to provide to you once you do decide that you want to retire. So roster transfers, as I said, a roster reconciliation is very important because even while you're still practicing now, in many cases we find that physicians are not aware of how many patients they actually have rostered with them according to the ministry. Now your EMR may say that you have 1,000 patients rostered to you, but from the ministry standpoint, maybe you only have 900, maybe you only have 800. So it really is important to make sure that all the patients you believe to be on your roster are in fact on your roster, especially from a transition standpoint as well. Signing on a new physician. If you're going to be doing, if a new physician is going to be coming on, they're going to need an add-on application to your FO. Again, that's something that we can help with on an ongoing basis. and we can help you to determine what applications need to be signed, what forms need to be signed, how the transfer of roster is going to happen, all of these aspects of bringing on somebody new. So optimize your practice. Ensure that all the bonuses and premiums are being tracked properly. So again, we want to make your practice look as attractive as possible to a new incoming physician. If a physician comes in and sees all they're getting from you is your capitation, you haven't been tracking your preventive care bonuses, you haven't been doing your special premiums, they don't know if your patient population will actually even allow for that. So we want to make sure that the incoming physician knows that you have a certain number of patients within each age category for your preventive care bonus to get as close to the maximum as possible. We want the physician to know that all your special premiums are there. If you do home visits, let them know that you're doing home visits. If you're doing office procedures, let them know that you're doing office procedures. If you have patients with serious mental illness that's going to allow for the bonus, let them know that. Make sure that all these bonuses are being tracked and paid out accordingly to make it look more attractive to a prospective buyer or new physician coming in. Educating the staff, as I said, will help with posters, will help with messaging, will help with letters, will help with determining what needs to be done for your patient population. If you have a little bit of a younger population, maybe they'll respond better to email. Maybe you start collecting emails over the next 6 to 12 to 18 months from all your patients, and then start email blasts saying, we're going to be retiring as of such and such date. These are the things that need to be done ahead of time. So all these aspects we can definitely help with. And then group planning. Again, if you're part of a FO, there's a lot more that goes into your retirement than just you leaving your practice. Speaking to them, letting them know with ample notice. Again, speaking with a new physician, maybe the group wants to have a say in who the new physician is. They're going to be working with them if they're in the same office. They should have the opportunity to meet a new physician and make sure that the personalities match and that the new physician coming in is going to abide by the governance agreement appropriately. We've seen too many times where a new physician joins a group, hasn't looked at the governance agreement, doesn't know, how much vacation time they're allowed, doesn't know if there's negative payback for their access bonus, doesn't know what's required of them for after hours. All these aspects really play a crucial part of having a new member join the FO. So it really is important that the group is involved in this transition process and allowing the group to help select a new physician coming in. Or if they want to take over the roster, again, give them the opportunity to say, the group wants to disperse, all 1,500 patients evenly across everyone, and we're going to pay you X number of dollars for that. So some of the key takeaways for today, transitioning your practice into retirement, it's not an easy process, and it's definitely not a quick process. We'll help you take care of that. Your roster is one of the most important aspects of your practice. Let us optimize both your roster and your practice. So again, roster reconciliations, making sure that all your bonuses are paid, making sure that your premiums are paid, making sure that you're presenting a well-oiled machine to the new physician. Set a reasonable value. We've seen in some instances where a physician is trying to sell their practice and they're just asking for way too much money. In the business world, yes, you can get away with asking for 5, 10 times what you're earning, but not in the medical world, not yet at least. So let's work together. Let's figure out what the proper value is. Let's figure out what will someone pay for it. And again, you can either do that or simply hand over the keys. If you're the type of person that doesn't want to sell their practice but wants to just hand over the keys and all the goodwill to somebody else taking over, then that's great. We're going to help you with that too. We just want to make sure all your options are there and presented to you and to make sure that you're set off in the right direction. And again, walking away can be tough with lots of loose ends. So we're here to make that process as quick and easy as possible. Of course, it's not going to happen overnight, but we're going to do our best to make sure that we help you as quickly as possible and as smoothly as possible. So that brings us to the end of our presentation for today. Thank you all for taking the time to join me to talk about retirement, or to start thinking about retirement and what really needs to go into it. You have our contact details there. You have my personal contact details there as well. Like I said earlier, please email me with any questions or concerns you may have. This presentation was recorded, so I will be able to send it to anyone who does need it, who wasn't able to join us, or if somebody had to leave early. I would be happy to discuss it in further detail with them and provide them with a copy of it. Again, thank you very much for everything, and I hope to speak to you all very soon. And we have a few questions that you guys could answer as well, with some resources down there that can be downloaded for your viewing purposes, or for somebody else to take a look at as well.